Welcome to VW Healthcare World. Today I have with me Prabhdeep Singh, someone who's redefining the emergency response in India. He co-founded StanPlus, a private medical transport startup which recently got rebranded as RED.Health. Let's speak to Prabhdeep to understand his journey at RED.Health, how it is evolving to disrupt the space, and what does the future of emergency response in India look like. Welcome to BW Healthcare World, Prabhdeep. Let me begin with a very first question that you started StanPlus, which is now known as RED.Health, as a step towards creating a Uber for ambulances. I mean, that's what I remember from our earlier conversation, which was almost like a year ago. How has that plan evolved since then?
Absolutely. Uber for ambulance concept actually lasted only 2 weeks early on because we realized that neither is supply formalized enough for them to aggregate on a platform, on a marketplace like platform, and neither is demand, that's the patient and patient's family, clamoring to open an app, put an OTP, and then send an emergency. In emergencies in India, what people want to do is speak to someone trusted, and they want to speak to someone now, right? So what happens in this speak to someone trusted and speak to someone now, unfortunately, a faceless interface like an application doesn't really work. There have been a lot of instances of people trying this globally, but given a chance, the audience here would also realize that we will default to calling our family doctor, we will default to calling our family hospital, or we would actually default to just carrying the loved one in our arms on a personal transport rather than open an app. So what happened from that idea to now is essentially all our insights and learnings having transported so many patients. I mean, we are now crossing 3 lakh plus patients transported, over 2 million calls answered. What's happened here is that we have unique insights on what happens in an emergency, a medical emergency. What are the right steps? What is the right hospital? How do we make sure that we can save a life? And hence, StanPlus, that was ubiquitous with ambulances, is now RED.Health or RED.Health. That's our website. At RED.Health, we enable the entire value chain of emergency response rather than just ambulances. And ambulances are an important, a significant, yet not the only component of the entire value chain. So we call these 4 T's: trigger, triage, transport, and treat. All these 4 are essential part of medical emergency response, and that's what RED.Health we do on a daily basis.
Got it. But how did the name RED.Health come up? Was there a reason to move from StanPlus to RED, and why RED?
There's a story here, and it's emotional story. One of our investors, who was Colonel Prasad, he was on his deathbed when he gave us money, and he essentially told me that he right before his death he gave some more money and said to me the following. He told me to change the name from StanPlus to something common, something that people remember in emergencies, something like RED. And he said, I am your target audience, and I don't remember StanPlus, but I will remember RED. So in a way, this was an answer to the question that the dying gentleman, and God bless his soul, he was there for us when we needed him. He said, change your name to represent emergencies, but change your name so that I can remember you when I have an emergency. And he actually, on his deathbed, gave us the brand. It became RED.Health.
Got it. And that definitely is an emotional story, and gives you the purpose, because it came from someone who not only gave you the ease of life when you needed the most, but also he was the customer, and it came from someone who was the actual user. So Prabdeep, I remember the last time that we had a conversation, You were extremely passionate about talking about the minimum standards that need to be maintained in an ambulance. I remember you and I had this conversation. And you were also talking about the standardization of ambulances. Yeah. Do you think this transition has happened in the industry?
I don't think so. It has definitely happened inside our company. Our ambulances are standardized, they're world class, they're state of the art. But has it extended to across the industry? It has not. It will require regulators to step up and notice that an average ambulance in India is driven by an unqualified, uneducated driver, and they don't follow standards. You would not let this person become a cab driver because there are more regulations around taxi cabs than there are for ambulances in India. We believe that the government, and we are working and engaging with governments across, how do we make sure that ambulances that get registered follow a certain standard, but also people behind those ambulances have certain credibility, have a certain capital, have an ability to do the job that they are getting permission to do, and that's transporting patients in emergencies and not dead bodies, right? In the end, those minimum viable standards, those Quality Council of India, like accreditations like NABH exists, NABL exists, we believe that having an accredited ambulance will go a long way in increasing trust. Remember, I mentioned, Harbinderji, that trust is important. People call someone trusted in emergencies. And how do we make sure in this industry we generate trust? And having accreditations, having a standardized response system goes a long way in saving yours and my loved ones.
Great. I think that's extremely important and it is becoming increasingly important. Pradeep, from road ambulances to air ambulances. And now also, if I went through your site and it said that you're also offering services like doctor on call for corporates, right? What prompted this evolution? I know you spoke about it briefly, but can you elaborate what prompted this evolution and where do you see RED.Health in the next few years?
In a we need to be very personal here when I answer this question. We don't wake up with at 2 a.m. with chest pain, and the first thing that crosses our mind is not, I need an ambulance. When someone wakes up with chest pain at 2 a.m., 4 a.m., or someone falls in the washroom, you know what they think? They think, I need help, right? They don't, the first thing they don't think is, I need ambulance. They think, I need help. So RED.Health is a medical emergency health platform. And that help could look like a doctor on call. It could look like paramedics showing up and looking at the situation and then deciding what to do. It could look like a hospital recommendation, people calling us and saying, I don't know where to go. Can you please request the hospital to block a bed for us? It could look like a concierge experience in the emergency department. It could look like an urgent care clinic where people could go get an ECG and then transported through an embedded ALS, right? The moment we did this exercise of removing the ambulance myopia and started thinking from what does the consumer and our customer want, they want someone they trust to help them in their most vulnerable state. And that's what RED.Health is. We are experts in providing emergency medical response, emergency medical care. And because we started as an ambulance company, because we started as ambulance owners, and we built technology and solutions on top, we've now become a medical emergency health platform, a medical emergency response platform. So it's very simple. We followed what all the management gurus, all my MBA professors, and all the global startup advisors say. Go listen to your customer. That's what we did. And we realized they don't need an ambulance, they need help.
That's a very powerful statement, Prabdeep, that, help is what people need, and that's what you offer as a service. Now, as a part of your service, you also talk about RED clinics. Can you tell us a little bit more about RED clinics?
Absolutely. In India, occupational health centers have been existent for the longest time. 1948 Factory Act says that you need a nurse and a first aid room embedded in a factory if you have more than 500 people employed there and more than 250 in many states such as Telangana. Similarly, global compliances for many large multinationals require that they have a doctor on site. So occupational health center is a beaten down industry. It's fully commoditized that we are now making into a RED priority clinic setup. This is the first step, embedded clinics inside societies, inside communities, inside RWAs, inside factories, inside head offices. Be present where people are is our philosophy. And RED priority clinics also have all the right diagnostic and urgent care tools that are required. Plus, because of our entire RED ambulance network, we have an ambulance never more than 10, 12 minutes away. So if someone comes up to our clinic and we do an ECG and we realize that the person may be showing symptoms of cardiac distress and needs to be moved to a cath lab or an ER, look, our ambulance is right there. So from a disjointed system of someone else owning an ambulance, someone else integrated into a hospital, someone else running a clinic, we've brought all of this together. And RED priority clinics currently are in embedded setup, but in the near future, they will be standalone urgent care clinics that bring patients into tertiary and quaternary care center through RED ambulances. So it's a fully modular and yet integrated emergency response system.
Got it. Beautiful. Prabhdeep, you raised capital from Health Quad. You have investors like Kalari and HealthX. Is there any new investments on the cards?
We keep fielding inquiries, and there's a lot of interest that is globally existing for this. There are a few reasons for that. By 2031, there's going to be 200 million Indians that are above the age of 60. These are people, and if I were to ask you, how many people do you know with diabetes, blood pressure, or some type of cardiac illness? I'm sure you can name many in your family and your friend circle, right? In India, because of the metabolic disorders, metabolic disease, we anticipate that as these 200 million people age, there are going to be disproportionately higher number of emergencies. This is on top already on abysmal numbers of accidents, abysmal number of fatalities in those accidents, right? So not only do we have RTA stress load, we are going to add a aging stress load and an increasing number of emergencies on top. Because of this, there is a lot of investor interest that comes in globally. Also, Health Quad, Kalari, and HealthX, they are incredible investors. Health Quad is today ranked as number one healthcare investor in the country, right? If you're a healthcare company and you want to have validation, you go to Health Quad. Having them on our board makes us a very attractive proposition as well for people wanting to play in the Indian healthcare system. But there's more to that. And the last part is as follows. Look, in terms of core infra that Indian healthcare delivery requires, we have primary care clinics. There's a doctor in every neighborhood. Then we have pharmacies. There's a chemist. There's a pharmacy in every neighborhood. Then a hospital. There's a hospital in India in every 10 kilometer, 15 kilometer radius, at least in urban centers. Then diagnostic setup, right? There's a diagnostic chain that exists in every region that's scaled up, whether it's SRL, Metropolis, right? All other health tech startups are tech layers on top, whether it is pharma delivery, whether it is teleconsult integrating into hospitals or primary care. Emergency response is a delivery infrastructure that is missing. So this is a unique opportunity that's double-digit $1 billion healthcare market in India that is that still exists to be disrupted. So we put it in the same category of hospitals. 20-30 years ago, before Apollos and Manipal scaled up, we had such fragmented market. Similarly for diagnostic labs, and now with Apollo Pharmacy and MedPlus and all of those scaling up, this particular segment of emergency response is a fragmented, extremely large infra market, and global investors, especially on the long-term infra side of things, see a massive upside here. And that's why, to answer your question now in brief, sorry for taking a long way to answering this one. There's not a single day I don't wake up to an investor inquiry, but at this point of time, we don't believe this is the right time to raise funds. We have the money required. We are scaling with positive unit economics. We continue engaging with investors, both Indian and global, but we are not taking any conversation forward because we are adequately funded right now.
Got it. And how big is the opportunity that you're targeting?
As I mentioned, it's double-digit $1 billion. Mm-hmm. And a lot of it is a latent market, right? Because we've seen in our anecdotal experience, in our surveys as well, that Niti Aayog, etc., have come out with, less than 10% actually take an ambulance, rest take their personal transport. If you stand outside a hospital, outside the emergency department, and see how many people walk in an ambulance, how many people walk in their personal transport or just walk in, only 10% take qualified help, 90% don't. So, how big is the market is essentially counting the Kalipili cabs in Mumbai and thinking that's the market of Uber, right? We will be massively underestimating it if you look at the current trips or current usage, because the market is truly latent. And we believe that as we scale up and more qualified operators come in, more and more Indians in emergencies will ask for qualified help, further increasing the market size.
And what is the span of your network? I mean, are you present all India? And do you have presence in tier 2, tier 3? If not, then what is your plan for going there?
What truly differentiates us from anyone else in this market is that we own the experience, right? I am building this for my parents, and I would not send a third-party ambulance to service that emergency. I always keep that on top of my head. Would I send a third-party service, some Shri Anjanya, or there are enough of these local operators? Would I send that in the most critical emergency that my family has, or would I send a red ambulance? And the answer always, Ravinderji, is I would send a red ambulance, right? Because I know that red ambulance is state of the art. It has all the necessary equipment, trained staff, it has the technology, and it is integrated with multiple hospitals. So from a span of the business, we are currently in about 20 cities with our red ambulance system existing. And our stated goal is that 100% of emergencies that we answer should be tackled through red ambulances and should be handled at free of cost, free of charge to the patient, because we have a model in which we bill it either to the hospital, employer, or the insurer, right? And for us, urban centers are harder to do than tier 2, tier 3. So we are present in Jamshedpur, Raipur, Bhubaneswar, Vizag. We are present in Farrukhabad, Lucknow, Kanpur, right? So for us, and now we are actually starting to go deeper into tier 3s and tier 4. So we are present in the likes of Sangareddy, Anantapur. So the thesis is go where the patient is. 60% of patients in India are rural, and 80 to 84% of healthcare spends in India are urban. So there's a lot of mobility that is happening from rural to urban centers, and RED is present there.
And Prabhdeep, who do you consider your competition?
My biggest competition is people not using me, but transporting their family members on their scooters, bikes, and cars. Because I mentioned that's 90% of the market. But apart from that, there are a lot of these aggregators who bring really bad quality of ambulances on their platform and essentially say, I have 5,000, 7,000, 9,000 ambulances on the platform. But if you ask them, hey, can you show me these ambulances on a screen? Can you show me pictures of those ambulances? They are unable to show because, they have an Excel sheet with local ambulance operators and phone numbers. And anytime someone calls them, they basically do everything manually. We own our ambulance, we own our experience. So in its truest manner, my competition is people not taking an ambulance because it's a category creation. But on a practical terms, when I deal with a patient, who do I price negotiate? Who do they price negotiate with? There are a few of these aggregators. They are easily Googleable. I have deep respect for them, for what they are trying to accomplish for fellow countrymen. But having said that, I think they may be killing more people than saving.
So, Prabdeep, what has been your learning in the industry in the past few years? Where do you think the emergency response business is headed? And I'm talking of the industry. How big is the opportunity? And you've answered that it is a double-digit billion-dollar industry, but how is it being disrupted in a positive manner?
Absolutely. Our job as an emergency response provider is to be present before an emergency happens, right? So that's why I said 4 T's, trigger becoming the most important. What is the trigger of an emergency today? The trigger is a symptom and someone calling someone, right? In the near future, as cars get into an accident or fire alarms detect fire or a variable detects an atrial fibrillation, right? These signals will become triggers, right? In next decade, the technology that we are building will mean machines are going to call machines in emergencies. And we are going to reach with our infra even before you and I have had a chance to essentially say, hey, I need help, right? So the answer is predictive emergency response. And for that, the job is to integrate across places, integrate across variables, integrate across wherever a human being spends their time. And for elderly care, it could be a pendant, right? For a person on an electric bike, it could look like detecting when a bike falls. So in the near future, the opportunity is to be present at the trigger, be able to triage quickly what's wrong, be able to transport the patient, and then be able to treat the patient. We are the only global company that has taken on the challenge to build technologies and infrastructure for all the 4 T's of emergency response. And we've invented the 4th T. The industry used to work with triage, treat, and transport. Trigger is completely ours.
Got it. Got it. So, Prabdeep, what you are trying to do, I remember, like I mentioned, that the initial conversation was regarding the standardization of ambulances, etc. What is your expectation from the policymakers, specifically to the complete emergency response business that you're trying to build?
Positive regulations go a long way in healthcare, right? We all want regulations around quality. As a patient, as an end patient, when I go in to get a surgery, I need to know that the regulators have looked at the equipment that is being used, the consumable that is being delivered. The doctor comes from a licensed university. The hospital at an overall level meets certain quality criteria, meets the fire norms, etc. Right? At a core level, that's why we trust large brands, because we believe that they meet all the regulators' requirements. Taking this analogy into our industry, we believe that the regulators in the near future will be able to bring many positive regulations that decide who an emergency response provider is, set quality standards for us, enforce them, and then hold us accountable if we don't do a good job, right? I am actually one of the rare companies in healthcare that's gunning for more regulations, because we believe, and I believe, that if I have to build this for my parents, then I need to be regulated to do a good job. It cannot just be on emotions.
Got it.
And even though National Ambulance Code exists, that applies to OEMs. It's driven through Ministry of Transport, the ARAI guidelines, and not through Ministry of Health and Family Welfare. And I believe that as Ministry of Health and Family Welfare, then Quality Council of India and other policy makers step in, look at this as a problem and solve it at a structural level. And I think one of the things that insurers need to do, of course, through IRDA, is to cover emergency transport, to cover emergency systems. Currently, they only cover 2,500 rupees of an ambulance ride. And as I explained before, emergency response or a call for help is more than just ambulances.
Got it. Got it. So, Prabhdeep, what is it that we can expect from RED.Health anytime soon? While you're expanding and you have the money, are you looking at some partnerships, acquisitions? What is it that we can expect from RED.Health anytime in the near future?
We run a very active corporate strategy function that keeps thinking about all these opportunities, including any acquisition or a strategic partnership or ability to scale globally, etc. But my desire is currently very focused execution of what we've promised to our investors and shareholders. That is geography scale, better quality, and shorter timelines to reach. And it will be fancy for me to give you a great answer on acquisition or on some technology. But what I've committed to the shareholders, HealthQuad, Kalari, HealthX, and everyone else who participated, is very simple. We're going to do a good job. We're going to reach faster, and we are going to deliver excellent clinical care, and the business will take care of itself.
So, Prabhdeep, you mentioned that going forward, what you foresee is that the first response is going to be triggered by a machine to a machine, right?
The first communication, the trigger.
First communication, the trigger. How are you going to be including AI or technology to build those efficiencies into your platform?
Absolutely. There are some of it is still trade secret, but we have a layer called RED Next that's looking at it. We are, in fact, this morning I've spoken to the team at length, and they presented to me how we are bundling AI into response system, right? Essentially, how can we, when someone calls us, how are we able to understand better what the patient is saying? Is there a way to understand how panicked the patient is? Is there a way to understand, what the medical condition translates to in emergency terms, etc., etc.? There's a lot of AI and LLM that we are now looking at in not only recognition of the patient, but also in CDSS, clinical decision support tools, to enable better response. We can't build this company to where we want to take it without actively using AI and its applications across the workflows to deliver better response. It's impossible for us to do it, and we are not ignoring it. We are building it day one.
Got it.
So sorry for that, but one of the key differentiating factor for any large language model LLM is the data set, right? Because to a certain point, the engine itself, the model itself, is going to become commoditized, right? Very soon, while we have Microsoft and OpenAI's ChatGPT, we'll also have Google launching, and I'm assuming everyone else is going to launch their own LLM. The key differentiator is going to be the domain expertise and the data set, because that is going to enable the LLM to do a better job, because we are going to be able to train the model. And we carry with us already India's largest emergency response data set, and in the near future, that's just going to go up. So by combining our data sets and our know-how to large language models, right?
Mm-hmm.
We are going to be able to deliver, starting from India and eventually to the globe, phenomenal savings in time, leading to better clinical outcomes, leading to more lives saved.
Got it. Got it. So, Prabdeep, my last question before I let you go is not related to just your business, but you. Every entrepreneur has a vision, a dream that they're trying to fulfill. And when they start a venture, it becomes their baby, and they're stuck with it. But what I've seen in your journey, and this is something that I realized while conversing with you right now, is that the evolution of ideas is something which you can't ignore. It will happen, So the business that you do today is not restricted to your initial idea. Very rarely do entrepreneurs are able to adapt to that change. What has been your experience as an entrepreneur? And what is the learning that you would want to share with the young entrepreneurs who want to begin their journey?
The key differentiator for us in an industry where the closets are full of skeletons, so many companies have died trying to solve this in India. The secret of our success has been listening intently to what our customer is saying. A lot of times we are arrogant about solving a problem that customer does not think is a problem, right? Or solving the problem in the wrong way. For us, listening to customer and understanding the changing needs and behavior of that customer has led to us rapidly evolving and staying a couple of steps ahead. I am also very paranoid by nature, right? What this means is that I'm always worried that I am missing something. There's some competitor that's doing something that we should be thinking of. So a good entrepreneur, I've realized, spends a lot of time thinking as well, reading as well, and adopting lessons learned from external sources, internal thought processes, and being able to execute these, right? So are you thinking enough and deeply enough? Are you asking the right questions? And once you have some figment of understanding and some, broad plan, how quickly are you able to execute? Do you match your execution prowess with your thinking prowess and vice versa? I think that's what for us has been a key differentiator. I'm a big fan of being a thoughtful leader, being a thinking leader, and then being a wartime CEO when it comes to execution.
That's brilliant, Prabdeep. Those are great learnings for anyone who's looking to do a startup. And it is coming not just by reading, but also experiencing the journey. So it's very insightful. Prabdeep, thank you so much for taking our time to speak with us.
Thank you for asking very relevant questions. Thank you.